Provident Healthcare Partners is a healthcare investment bank that is focused on transaction advisory services. We created this podcast for healthcare executives, entrepreneurs, shareholders, and providers who are interested in learning more about the world of healthcare consolidation.
Hi, everyone. Welcome to Provident Dealcast. My name is Steven Grassa, and I'm a vice president at Provident Healthcare Partners. I'm joined by two colleagues of mine, Tommy Spiegel and Dan O'Brien. Tommy's a senior associate and Dan's a senior analyst at Provident, and both cover the behavioral health space alongside myself. We're also joined by Paul Gomez and Tim Perrin at Polsinelli as well. Thank you guys very much for joining. Would you like to introduce yourself and your firm to kick things off for us?
Hi, this is Paul Gomez, a shareholder at Polsinelli and chair of the Polsinelli Behavioral Health Law Group. I've been practicing healthcare law for the past 20 years plus, and always focusing on mergers, acquisitions, and related regulatory issues. I'm very pleased to be part of this podcast. Thank you for inviting me.
Yeah, hey, Tim Perrin here from Polsinelli, one of the lobbyists here, working mostly on the federal level and done a lot of work in the behavioral health policy space over many, many years. Worked on Capitol Hill a long time ago, and a very exciting policy space, to be sure.
Today, we're going to be discussing the behavioral health space, specifically focusing on a few of the more active subverticals within the industry, namely autism services, addiction treatment, and mental health, all of which have experienced unprecedented demand and seen significant investment in consolidation activity over the last few years. There's some stark differences, but also some overlap between the sectors in terms of key trends and themes that are playing out in each of the spaces. But Tommy, why don't we focus on the autism services space first? Can you speak to what we're seeing at a high level within the world of ABA therapy?
Yeah, thanks, Steve. So the autism services space is currently faced with a supply and demand imbalance. So we've got outsized demand for services, primarily driven by rising prevalence and expanded coverage, but also supply constraints from labor challenges and, more recently, inflationary pressures. From an incidence level perspective, everyone has heard the stats from the CDC, right? So effectively, the number of children born with ASD doubled over the last 10 years. The good news is that as of 2019, all 50 states require treatment coverage. The actual costs, however, can vary based on the therapy plan and hours of treatment, and the per year individual cost can be upwards of $50,000 to even $100,000. And as it currently stands, most states, only cover up to $36,000, but this can vary from state to state and even by age cohort within each state. Some states even have a maximum lifetime benefit. I think insurance coverage is moving in the right direction, but we have more work to do to ensure providers can accommodate an individual's needs without reducing hours and sacrificing quality. In line with the rising incidence levels, the demand for providers has skyrocketed over the last decade. From a geographic perspective, about half of counties in the U.S. don't even have a single BCBA. And of those, 300 don't even have a BCBA in a neighboring county. And at the same time, companies are reporting that inflationary pressures are adversely impacting their ability to hire and retain workers. We have rising energy costs, rising supply costs, rising wages, all while government reimbursement has really remained static. And with that, it's been difficult to maintain margins on a unit economic level. I think the breaking point was coming, which we all saw across news headlines earlier in the summer.
Seems like a key theme here is the growing imbalance in supply versus the demand for services. There's already pretty pronounced gap prior to COVID and prior to the Great Resignation, but the waters seem to be even more difficult to navigate these days for operators. What about the addiction treatment in mental health space, Dan? What are you seeing in terms of themes and trends in those spaces?
Yeah, I'll echo a lot of what Tommy said in regards to the autism services space. We're seeing a lot of the similar, more thematic trends playing out in these two spaces as well. I think from a demand perspective, the need for services has never been greater in these two sectors. Over the past 18 to 24 months, we've been seeing a rising influx in mental health diagnosis and similar and increasing prevalence in substance use disorder, with the opioid epidemic still really gripping the nation. I think COVID really put a spotlight on some of the shortcomings that our health system really has today in addressing these issues. As demand continues to rise, we're seeing how some of these gaps in care are really affecting the patient experience. In 2021 alone, the global prevalence of anxiety and depression diagnoses increased by a quarter, over 25%. Now, I think when thinking of kind of why this is occurring, there's a couple of factors that are playing into this. I think for the better. First and foremost, there's a massive destigmatization that's going on in the mental health field. People are coming forward with their mental health issues and seeking the treatment that they need, which is giving rise to obviously, more diagnoses. And then also the other emergent trend here is the accessibility of treatment. I think as seeing the mental health space put such a pressure on our healthcare system, we know the space had to adapt, and there had to be kind of creative strategies put in place to expand the accessibility of treatment. And I think one way that we're seeing that of recent has been the emergence of these kind of digitally native platforms that's allowing people to get mental health treatment from the comfort of their own home. And then I think in contrast to this on the payer side, given this influx in demand and emphasis on accessible behavioral health treatment, payers have to respond accordingly. People with severe and persistent mental illness, they can cost the healthcare system 3x what someone with kind of no behavioral health needs will, cost the same system. And payers need to prioritize making these behavioral health services available at low cost to the consumer, because it's a space that was kind of once dominated by kind of higher end treatment for people that could afford out-of-network rates, cash pay alternatives. And I think payers really have to adapt to make this a more affordable treatment option for the everyday person. And then in terms of the supply side economics, I think Tommy covered that very well. I mean, in this space, we're seeing hiring just getting extremely competitive, certainly among those kind of higher level advanced practitioners where, these are the people that are kind of doing the diagnoses and medication management. You have all this demand, but not the same kind of graduation rates coming out of the institutions that are, supplying these advanced level practitioners.
Then if you look at the space through a regulatory or policy lens, Tim or Paul, maybe you could opine on what you're seeing within the legislative arena.
Yeah, thanks, Steve. This is Tim. There is a lot of activity on mental health and substance use disorder policy. There's a lot of bipartisan interest, and that's something that is kind of rare these days, right? Where we have bipartisan interest, but we also have two branches of government. The Congress is very invested in doing something in the White House. Let me just give you a quick snapshot. This summer in June, following a couple of school shootings, Congress passed and the president signed into law mental health and gun safety legislation. There was obviously a lot of focus on getting resources into communities and to schools. That was a pretty significant move there. Very shortly thereafter, the House of Representatives passed their mental health and substance use disorder bill, which essentially reauthorized and plussed up a lot of existing programs. But the Senate did not take action on that bill right away. All of us that work in this space are very anxious to see if the Senate will take up mental health and substance use disorder legislation. We're hearing rumors that that's going to happen and that there's steps are being taken to do that. But you may have heard that it's an election year. We'll see what effect that has. On the administration side of things, President Biden has taken a lot of steps and in particular has focused a lot of his administration's agenda on behavioral health, focused on students and children and the impact that COVID had, pandemic, the school shutdowns, really trying to focus a lot of attention there and resources, directing federal resources, especially to underserved communities. The president has had some celebrities in there and brought Selena Gomez in recently and had a town hall there, really focusing more on teens and the impact of anxiety and depression in teens. One other thing to focus on, I think that's really important, is the impact that social media is having. And this is one area where the administration is really focused on trying to figure out and get answers from these big tech companies and their impact on, how social media is impacting the mental health of users, particularly teens and young people.
Great. Paul, I'm not sure if you wanted to kick in there or if you wanted to wait until we move a little further down the agenda, but I want to give you the opportunity to chime in if you had anything to add.
Thanks, Steve. I think Tim's really spot on with a lot of the developments that we've seen this year, and then it looks like we're going to continue to hopefully see as we continue to progress and as Congress comes back in the fall that touch on mental health and also substance use disorder and other initiatives. And I'd like to add just a little bit to that if I could. I think I've heard the themes of really access here, access to payment, changes in payment. And then what I think we've really seen in healthcare generally, and then also I think we're seeing increasingly in behavioral healthcare, is that as you begin to see greater access to treatment, as you begin to see more payment, more dollars, more investment flowing towards behavioral healthcare, much like we saw in more traditional physical healthcare, you're going to see also increased regulatory requirements, legislative, legal requirements. You're going to see increased enforcement of different regulatory requirements. They tend to go hand in hand as the sector, I think, matures and you begin to have just much more complex regulatory structure around the sector. So a couple of things I'll touch on payment and access, and then I wanted to just highlight a couple of things that I think are also important for anybody in the behavioral healthcare provider sector and investors to be aware of. One is we've seen some advancements and some loosening of requirements in the telehealth side. More can certainly be done, but we've seen some movements, I think, in the right direction there, at least from my perspective. One is that Medicare CMS recently loosened requirements for providing certain telebehavioral health services for mental health disorders, diagnosis, evaluation, and treatment. Loosening restrictions around where the patient needs to be, doesn't necessarily need to be in a rural area as they were in the past with some of these requirements and payment restrictions. And also opened up some requirements that gave greater flexibility for providing these services via audio only technology. So think, over the phone, as opposed to more stringent requirements of the past that would require two-way visual and audio equipment to be put in place. There's more, again, that they can do to further loosen it, but at least I think a movement in the right direction. And a lot of flexibilities that we've seen over the last couple of years, of course, arose very quickly during the public health emergency, and some are due to sunset unless, of course, action is taken. Another example of that would be clinical providers within outpatient departments of hospitals being able to treat certain patients via remote technology. There's a proposal now to make those flexibilities permanent instead of having them sunset as well once the public health emergency declarations on the federal and some state levels subside. So also seems to be moving a little bit in the right direction. And then some guidance that came from the White House in June of this year, which doesn't have the force of legal requirement or regulatory requirement yet, but signals support and I think some urging about what direction they're hoping legislators and regulators will go, including generally looking to make flexibilities that were put in place during the public health emergency permanent telehealth and provision of those services, both in the mental health sector and also substance use disorder treatment sector, and then signaling greater payment available for those as well. So I think very helpful indications, at least, and hopefully helpful tailwinds for those who are looking to invest in behavioral health. On the payment side, there's a lot of buzz lately about value-based care. Those are certainly laudable, and we've seen some movement and progress in that direction over the last 10 or 15 years for healthcare more generally. Now we're starting to hear a lot more talk about that with respect to behavioral health and how to better integrate behavioral health with traditional physical health. One example of those have been the greater use of collaborative care models through CMS and in Medicare. There's a few other similar models out there from other payers. But that really has been an initiative to better integrate mental health services into primary care settings, with the primary care physician serving as the leader of a team of behavioral health care providers, including managers, psychiatrists, and other mental health professionals. The proliferation of these is going to really depend on a lot of investment, a lot of time, a lot of patience, and really getting more agreement about what metrics should be used to measure what the value is. That's been a challenge in overall healthcare. It will be in behavioral health as well, but I think that will continue to see movement in that direction. On the flip side of that, I mentioned about more access, more payment, generally leading to greater regulatory requirements and a larger compliance structure to have to worry about. A couple of things I'll highlight there very quickly. One is we've seen enforcement in the past in behavioral healthcare dealing with fraud and abuse issues, inappropriate generation of business or referrals to behavioral healthcare providers, much as we've seen in the larger healthcare sector. Those have tended in the past, again, to be insurance fraud statutes, some travel-related statutes, and also, to the extent they apply, anti-kickback statutes. But there was a perception that there was somewhat of a gap in terms of application of these laws to behavioral healthcare providers who may not receive any government payment or might have been traditionally very heavy cash private pay. Part of addressing that was bringing forth the Eliminating Kickbacks and Recovery Act of 2018, or ECRA. There was not initially a lot of enforcement around that. There has started to be a lot more enforcement now. It is somewhat similar to anti-kickback statutes on the federal and state level, but it does not depend on whether there's government payment involved. And it applies to treatment facilities, sober living facilities, and laboratories. And some other states may have some variations on that. The penalties are severe, so it is important that everybody really pay close attention to this and to evaluate compliance as you're looking to invest or as you're looking at potentially going to market, with penalties being up to $200,000 per occurrence of a violation of ECRA, or up to 10 years in prison per occurrence. So the penalties are potentially severe, and a couple of arrangements that I'll mention just as examples of things that could implicate ECRA and other fraud and abuse statutes would be arrangements for compensation and marketing services, agreements with call centers to help generate patient referrals, waiver or discounted fees, co-payments and deductibles, payment for travel for patients to come to a particular treatment facility, or securing insurance for patients or paying their premiums in order for them to receive treatment at your facility. Just a few examples there as illustrative to kind of keep in mind the areas of operation that we should all bear in mind when we're looking to potentially invest in one of these treatment facilities. And then a final word I'll say about taking care with earnouts. This has been an area of concern before ECRA, but now potentially even broader application. Earnouts need to be handled with a great deal of care. And I suggest having legal advisors in place so that you can incorporate appropriate incentives and lower the risk that the earnout or compensation structure might be viewed as an inappropriate incentivizing patient referrals or generation of business from those who are in a position to do so.
If I could build on Paul's list, there's a couple of factors to take into consideration that intersect with the public policy sphere. And the first really is the workforce and the shortages that we're seeing in this. And Tommy touched on this, but we look at what's happening in California with the Kaiser counselor and therapist strike. There is legislation being considered by Congress that would help out a lot with these workforce shortages. Unfortunately, we just haven't seen a lot of traction on the workforce expansion side of things. We've seen a lot of funding of programs that will help access, but we just really haven't seen the boosting of the workforce. So taking into the health of the workforce and what that status of it, what that looks like is one factor. The other is that geography matters. And this was touched upon earlier, but one of the things that the gun safety and mental health legislation that Congress passed this summer does is that it grants even more states flexibilities within the Medicaid program that would help states bring about better mental health and SUD treatment programs. And more states are going to be able to apply for these flexibilities in the coming months and in the next couple of years as that program becomes more fully implemented. So that's just something to keeping that on the radar screen as these considerations are made would be helpful.
A lot of moving parts, a lot going on within behavioral health space.
Absolutely.
Let's transition now to the investment side of the house. How have these trends that we've touched on translated to deal making or investment activity within the industry? We can start with you, Tommy. What are you seeing within the autism services segment, specifically from an investment and consolidation perspective?
Yeah, so, despite some of the supply challenges, the demand for services here, really continues to draw investor interest. We still see an opportunity to increase accessibility, expand service offerings, and bolster corporate infrastructure, all while striving to, improve an individual's experience and outcomes in a treatment program. The first point here is that the market is still quite fragmented. Even with 40 plus platforms and consolidators, several groups across the country have annual revenue less than $5 million, and it's estimated that no single practice even holds more than 5% market share. That being said, deal volume has slowed from what we saw in 2018 and 2019. Over the last few years, we saw a lot of financial sponsor activity as private equity-backed platforms began to expand via acquisition. And this created increased competition for add-on acquisitions. And as a result, some of those frothy, double-digit valuations we all saw. Today, we still see the elevated demand for tuck-ins, but also expect to see, a rise in secondary and tertiary buyouts, or even consolidation among larger platforms. For example, it was just announced that Next Phase Capital was selling its stake in Action Behavior Centers to Charles Bank Capital. And that transaction garnered over $800 million, or an implied 14 times EBITDA multiple. Autism in Motion clinics aligned with Hope Ridge earlier this year, representing one of the larger strategic transactions over the last 12 to 18 months. The other primary transaction trend is the development of integrated care models. So, we've seen several companies with services that span mental health, special education, and pediatric therapy acquire ABA practices. So, for example, Five Arrows Capital Partners, they invested in the Stepping Stones Group in 2017 as a diversified special education and behavioral health provider. Since then, the Stepping Stones Group has expanded service offerings to include ABA therapy, initially with the acquisition of New England ABA in 2019, a transaction that was actually represented by Provident. The Stepping Stones Group has continued this strategy, most recently with their acquisition of the South Coast Autism Center earlier this year, representing their entry into center-based care in Massachusetts.
Yeah, I think this space follows a similar pattern to some other subverticals within healthcare services. They're a little bit more mature, further along in their investment cycle, in that the first phase of investment is typically predicated on expanding access, right? And then that's typically followed by investment dollars focused on improving outcomes and positioning platforms to have a seat at the table with payers. Dan, has mental health or addiction treatment followed a similar trajectory?
Yeah, thanks, Steve. I think from a deal volume standpoint, certainly the mental health and SUD spaces continue to see increased deal volume. 2021, was a record year for both transaction volume and dollars invested in both sectors. Just to put it into perspective, 50 deals got done in Q4 in 2021 alone, and that was across mental health and addiction treatment combined, which is just an absolutely crazy number over a span of 3 months. I would say the addiction treatment space is a bit more mature from a consolidation standpoint. 2021 was really marked with a litany of add-on volume. Established platforms like Baymark Health Services, Discovery Behavioral Health, and Community Medical Services, are all competing for add-ons in the space. And then to that end, in 2021 and 2022, you also had well-established players like Summit Behavioral Health who underwent a tertiary buyout. So they're now on their third rendition of private equity capital, which is just kind of evidence of the increased private equity appetite in the addiction treatment and mental health space, and kind of looking to cash in on the ever-growing sector that we see. And then contrasting to the addiction treatment space, I think the mental health space is still, I would call, in its early stages or its infancy as it relates to consolidation. And in 2021, I think this was the year we really saw a lot of dollars get put to work in the establishment of some really marquee platform-level transactions. You look at groups like Geode Health, who had received investment from KKR, and Transformations Care Network, who received investment from Shore Capital. These are two private equity funds that we've seen had a lot of success in the healthcare services space historically outside of behavioral health. And I think these two transactions are evidence of their growing interest in the space and kind of need to cash in on a growing sector. And then in terms of kind of trends we're seeing within the space and the types of deals that are really getting done, buyers are really hyper-focused on kind of the outpatient space currently. In 2021, only 5% of the deals that got completed were of kind of a strictly inpatient focus. And then 34% of deals were, I would call, strictly kind of outpatient focused. And then 61% kind of had this both hybrid inpatient, outpatient focus. And I think this is indicative of the shift we're seeing in the industry towards a multifaceted approach to care, where you have kind of treatment options for kind of each level of acuity as it results to patient needs. And I think buyers are placing more value on those assets that kind of have deployed this multifaceted approach to care and can kind of serve multiple patient populations. But in terms of the outpatient programs, these present a lot more attractive asset from an expense profile, right? There's the scalability of these types of groups are a lot easier because they're asset light. You don't need to make the same kind of level of investment in real estate and back office operations to really scale the business beyond its existing footprint. And then really, I think the last interesting trend we're seeing is more and more dollars being put to work in these kind of tech-enabled platforms. We're seeing unicorn level valuations for groups such as Cerebral, Headspace, Modern Health that are really taking behavioral healthcare into the home and deploying kind of more historical talk therapy approaches to care on a totally digital and online space, which, as we know, is kind of the most scalable option of all three here, which is why I think we're seeing kind of more and more dollars being put into investment in kind of these tech-enabled services.
A lot of deal making within both spaces. And I'm sure many of you listening to this podcast have solicited interest from a banker, a prospective buyer, private equity firm, what have you. Some of you may be entertaining a deal. Many of you probably know somebody who's been through a deal before. Paul, what would you say to the business owner asking how best to prepare for a transaction process from a legal perspective?
Thanks. I think I would look at it in at least a couple of different buckets, but they're all related. One is I would really help engage in the careful thought about what are your key goals and objectives in looking to potentially come to market and sell your practice. And the other is sort of a self-assessment of your practice about how well you're doing on a compliance standpoint, looking at it operationally and also from a payment standpoint. So I'll explain a little bit what I mean there. One is, again, going back to the objectives and the goals, asking yourself honestly, what is the most important thing you're looking to achieve in going to market and potentially selling your practice? Is really the highest purchase price going to be the primary objective? Of course, that's always important, but trying to weigh that against other objectives you may have in selling your practice. For instance, how important is rollover equity to you? Is that something that you're going to be interested in, as well as the potential for a second exit somewhere down the line? Are you interested in continuing as a practitioner? If you're a licensed healthcare practitioner yourself, do you want to continue to practice and see patients with the clinics that you've just sold or treatment facilities that you've just sold? Or do you plan to move on, do something different, or perhaps retire? Are you looking or interested in any kind of a leadership role post-closing or some kind of administrative duties? Do you want to have a significant voice in strategy going forward and continued growth of the clinic, which can go hand in hand with whether you're interested in rollover equity and other priorities or goals or objectives you may have? And how important is it to preserve certain employment relationships going forward to you, certain key employees, perhaps yourself, perhaps some others, that you're, in your view, are vital to the continued success and value of the treatment facility or the clinics or other behavioral healthcare provider going forward? And how important are brands, protecting the brand, protecting certain practices, whether those are clinical or non-clinical, after the transaction is done? Having those things clear in mind, and then having clear communication with a potential buyer or the actual buyer about what your objectives are, and measuring how well those match up with the buyer is receptive to and what they would like to see going forward, is really going to be key, not only to getting through a successful transaction, but I think also key towards how successful and how smooth that will be after the transaction is done, as the integration phase is really kicking in, and as you continue to work together, if you are going to work together post-close. Now, in terms of getting yourself ready to go to market, beyond honestly assessing your own objectives and goals, I think there's a number of things that a seller can do before going to market to help lower the risk level of an investment in their practice, and which could potentially lead to higher multiples, a higher transaction price, and really just help, I think, facilitate a smoother transaction all along the way. A couple of examples would be to consider engaging in a kind of a pre-market compliance or coding audit, which, if that's going to be done, I would highly recommend that be done under the direction of legal counsel, so that you have legal privilege protection attached to that. But that can help you identify actual or potential legal compliance or payment matters that can be addressed proactively, or at least start to be addressed prior to engaging in serious discussions with buyers. It can help you, again, on a proactive basis, help identify any weaknesses in your current compliance plans or billing functions that could use some improvement. In other areas, I think that would be useful to spend some time in as you're getting ready to go to market would be really taking a look at some of your key corporate documents, your key employment contracts, shareholder agreements, payer agreements, leases, agreements with key vendors, policies and procedures, to ensure that you have a good sense of what might trigger certain approval requirements, or what might trigger requirements to get consent to assign some of these contracts, if they will be assigned, or to what extent the transaction might otherwise trigger an approval, even if no contract is going to be technically assigned. And the same kind of review, at least initial review, should be given to licenses, permits, accreditations, et cetera, so that you start to have a good sense of what kind of approvals, what kind of filings, what kind of consents are going to be needed, likely in connection with pending sale of your practice, and whether those are, have significant lead times, whether those are all pre-close, whether anything is post-close. Help you plan in advance, address those with the buyer, helps you get on the same page earlier, and helps avoid unwelcome surprises that could delay and potentially derail a transaction down the road. All of that, of course, does involve some significant investment of time and resources and money. So a seller needs to have their eyes open about that in considering whether to engage in that process. But at least from my experience, I've seen that to the extent that they do, it can be very helpful in terms of ensuring a much smoother sale and possibly even a more financially rewarding sale and successful transaction down the road.
All very pertinent items to consider from a legal perspective in prepping for a potential sale. I would say in preparing for a deal from a business perspective, it's good to know sort of the key value drivers and attributes of businesses that buyers will typically look for. Maybe we can kick it to Dan. What are sort of the markers of a premium asset within behavioral health? How could you best position your company for a sale from a business perspective?
Yeah, I think one area of kind of key diligence that buyers are really going to look at is from a corporate infrastructure perspective, how professionalized is the business that they're evaluating? Groups that have put money to work in developing kind of a robust back office are obviously going to be viewed, more favorably in the eyes of a buyer compared to those groups who are kind of haven't made those same levels of investment. And specifically, what does this look like? This means investing at the senior management level with a team that has industry tenure, has a growth mindset, and is kind of well equipped to take on the challenges ahead. I think similarly, groups that have professionalized utilization of technology and implementing services such as data analytics and data capture to assist in payer negotiations are going to be certainly viewed more favorably. And then also, as Paul mentioned earlier, groups that have placed an emphasis on compliance, are going to be looked at very favorably in the eyes of a buyer because they know kind of the sticking points, in diligence that are going to arise. If you can have kind of point to that data at your fingertips, point to outcome level data, utilization metrics, profit margin across business lines, that will obviously present very well. And then lastly here is investment in the billing and collections department. Behavioral health has long been a sector within healthcare that's kind of struggled across the revenue cycle. And it tends to be particularly cumbersome from a revenue cycle standpoint. So to the extent there's been investment made to professionalize the billing and collections department and kind of the necessary resources there have been ironed out, that will present very well to the buyer community. I think the second tenet here is the marketing and the patient acquisition. There needs to be a consistent track record of patient recruitment and patient retention, and also the deployment of kind of a multifaceted approach to patient acquisition. Buyers are going to want to see a diversity across referral relationships. They're going to want to see a pretty strong digital presence as it relates to patient acquisition. They're going to want to see that you're kind of well respected in your community from a brand equity standpoint. That's going to be kind of really a huge value driver as they look to kind of grow the platform into the future. I think the last tenet we'll want to look at is kind of what does the payer landscaping look like for this particular business? Maybe most important is ensuring that the business is well contracted from a commercial and government standpoint. This is going to be really important to reduce the cost burden that's placed on the patient and greatly improve kind of the collectability of the earnings of the practice. Upon acquisition or investment, most buyers are going to transition these programs to an in-network model. So to the extent that those contracts are already in place on day one, it's going to really remove the lag time and the need to get providers credentialed and the business transition from an outpatient cash pay model to an in-network contracted model.
A lot of what Dan just said really transcends to the autism space, but the name of the game here is staffing. Demonstrating a proven ability to recruit and retain top-tier talent. I think most people think the solution to turnover is higher compensation, but that's not always the case. So the Autism Investor Summit earlier this year had a great presentation on, compensation and turnover in the space, where they looked at the primary predictors and drivers of turnover. They found that while you should understand compensation in your market, you should focus on, what you can directly control. Focus on employee satisfaction. Provide opportunities for development and help your employees grow professionally. Help them get better at, and in the words of the BHCOE, what they do and what they love to do. If you were not able to catch that presentation, I know is still offered on the website, and I highly recommend it.
In this market, yeah, I'd say retention, turnover, employee churn, all probably the most scrutinized business diligence points in all of these processes. It's top of mind for every platform that has an existing presence in the space or every investor looking to make a move into the behavioral health space. From a legal perspective, though, what are the most common difficulties to a transaction success? What are the biggest barriers that you typically run into, Paul?
Some of this will echo a little bit, I think, of what I've begun to talk about just a bit earlier, and it'll be sort of a mix, I think, some practical tips, but also some specifically on the legal front as well. One thing that I've seen just through all healthcare deals and behavioral healthcare deals is the extent to which there's a careful assessment by both, frankly, the seller and the buyer in terms of whether there's really a business cultural fit, a shared strategic vision, and really trust between the parties. To the extent you have those, and those, frankly, should be assessed very early on, but to the extent you have those, it's going to bode well for your success post-transaction. It also, frankly, as things come up, and they always do during a transaction, either expected or unexpected, to have to be dealt with. When you have that trust, you have that feeling of a shared business culture and a shared vision, the parties have a much better chance of successfully working through those issues in a constructive way, as opposed to other transactions in which it's apparent that there's not a whole lot of trust going on either side, and it makes it just that much more difficult to try to negotiate a successful resolution or compromise to any given issue that comes up. And if you're having those issues during the deal, it may be more likely you're going to continue to have issues like that going forward afterwards. So to the extent you can get a good handle and assessment on those very early on, I think it'll, one, bode well for a successful close, and then two, how well you're going to do post-close, particularly on the seller side, if you're going to continue to stick around. Another, and I think sort of in line with that, is really how clear both the seller and the buyer have been with themselves and with each other about core terms and aspects of operations that are important to each side going forward, what their roles will be, what's expected of each other. To the extent that those have been clear and communicated early and often, that bodes well for getting through to a successful transaction and then also post-close operations. It also helps with both sides' advisors to the extent they understand those clearly, because it will help them in terms of the resources, time, et cetera, that you might give in prioritizing negotiating one term over another and really having a better sense of what the key material terms are that require a great deal more time and those that really are not so important, and you should not devote so much time to them. Really stick with what's the most important and prioritize those, I think, accordingly. Also, the expectations, I think, about how much skin in the game is required, if there will be some, what's the expectation both from the buyer and the seller of the seller's role in that regard and the investment that they will make, which ties into other aspects that might be important both for the buyer and the seller in terms of seller involvement in leadership and strategy going forward. And then another that I would mention and note, it's sort of cliche, everybody's heard it, but I think it's important to mention, and maybe a little cliche because it's true, and that's time kills all deals. So to the extent that the parties can identify and commit to a specific time frame and certain benchmarks that should be hit along the way to show that we're making progress, that tends to increase the chances of a successful transaction and signals really, I think, to both sides. To the extent you commit to those timeframes and show that you're doing your best to meet those and to meet those metrics you've agreed upon, shows a lot of good faith between the parties. It shows each party that the other side is also willing to put in the resources and the time to make that happen, that they're committed to the deal. And that, of course, then reinforces the trust, hopefully, that is there and continue to grow between the parties. But in addition to those, I'll mention a few others that can cause difficulties or potentially derail a deal. And this, I think, is consistent with other remarks I've made earlier about just early preparation, clear identification of what any potential issues are, how you might address them, and then communication about those in an effective way and being very proactive. Is that to the extent you have surprises about potentially fraud and abuse compliance issues, things that could have a material impact on reimbursement or might call into question for a buyer how reliable projections are in terms of revenue if you're seeing potential fraud and abuse violations, or if you're seeing a lot of errors in proper documentation or coding for different services, to the extent that you have these extensive payer relationships, whether those are commercial or government, whether the liabilities at issue might involve a substantial monetary amount, or they may potentially have a material reputational impact upon the treatment center, the practice, the provider, potentially impacting loss of license, et cetera. Those things could derail a deal. And to the extent that liabilities do crop up, or potential ones, disagreements among the parties about how serious they may be, what the exposure is, what the right corrective action may be, and whether that needs to happen pre-close or post-close. Some of these are, by their nature, matters that you will have to address and figure out and negotiate with the other side in good faith as they arise. But to my earlier point about early preparation, self-assessment, looking into these issues ahead of time, and then communicating early, what you try to do ideally with all of this is minimize the instances of that happening. Try to mitigate those and try to be proactive so that to the extent they do arise or they are there, there's been early communication, proactive engagement, and attempts to remedy and address these issues so that you hopefully avoid, or at least lessen, the chance that something significant arises late in a transaction, which then has a greater chance to derail it.
Appreciate the color, Paul. And I'd say the next topic we wanted to cover is probably one of the more top of mind areas for a lot of operators and business owners in the space, essentially centered around the impact that all this investment has had on quality, company culture, outcomes. The name of the game in healthcare, and behavioral health specifically, is ultimately to provide high quality care at scale and improve outcomes in the lives of patients and their families. Do we have a pulse on the impact that consolidation has had on the space, for better or for worse?
At a high level, I think it's fair to say private equity is fueling the growth of mental health treatment. I mean, the demand for services combined with, expanded insurance coverage has really driven outside investor interest over the last handful of years. Private equity investment, they bring infrastructure and back office support, improved compliance, improved IT systems, and even negotiating leverage with payers. One of the biggest or bigger areas of focus right now that we've seen is also outcome tracking. However, I think recent headlines on labor challenges and layoffs have shined a negative light on private equity's investment in autism services. While these headlines all appeared over a handful of days, I think, there were issues that built up over the last few years. I think it's easy to look at rising incidence levels, and then also how COVID, highlighted the need for services without taking a step back and addressing, the national shortage of providers. The competition for, BCBAs and RBTs led to higher wages, higher turnover rates, and individuals, they jump ship to work for other companies. The result, all companies are paying more, and plus the staffing shortage, limits the revenue opportunity. Combine this with stagnant insurance rates, and you can really see where the problems start to arise. At the end of the day, the goal should be to, enhance quality care and let that drive increased revenue and profits. But the current reimbursement landscape really doesn't support this. This idea has really begun to put pressure on payers for value-based care models, where clinics are paid based on outcomes and not per visit. Several of the operators we talked to, believe this could help with workforce challenges while also helping achieve better outcomes. But again, all this being said, it's important to note that private equity has brought much needed capital and operational efficiencies to the space, resulting in more accessible treatment for individuals and their families nationwide.
I agree with all of that. And the only thing I would add or echo a little bit too is I think overall the consolidation, the investment that we're seeing in behavioral health care over the last several years now, and certainly being ramped up in many of the sectors, mental health in particular, but really a lot of the sectors of behavioral health, have overall been beneficial. And Much of the activity, as you know, is being driven and historically has been driven the last 10 years plus by private equity investment. I think that's going to continue, although we're starting to see a little bit more investment coming from also, health systems, hospitals, for-profit and nonprofit. But the consolidation in the investment, has already been noted, is by itself not necessarily going to result in improvement, but it's really how wisely that investment is made and what it's focused on. If the partnerships that are forged, key clinicians in place that will have the expertise to help inform really what the appropriate metrics should be, how to measure better quality care for the patients involved, and then use the resources coming in from private equity and other investors then to support that and expand that and grow that in a way that's scalable, that's effective, is measured, and then reinvested in the areas in which it's shown to be working. And I think then we'd continue to see some very positive effects coming forth from the consolidation. The part of a limitation or a headwind against that, it was also just touched on a moment ago, is really the payment issues. We've had progress on the parity front in terms of parity of payment between traditional physical healthcare providers and behavioral healthcare providers, but there is still a lot of work that remains to be done. The White House has taken note of that. Others have taken note of that. There are important court cases that are out there continuing to litigate through that issue. So I think we'll still see developments on that front. And also in some cases, stagnant reimbursement. I think it was mentioned as a factor going on with ABA providers in the autism sector. It is with others. That is going to be an ongoing remaining challenge. Continued consolidation and smart payer negotiation strategies can help with that. That is also something that folks like my colleague Tim on the lobbying front may also be able to assist with. I think overall positive. It's not inevitable that simply consolidation will lead to this higher quality. It's really how we go about doing it and whether it's done in a smart way, and then the progress we can continue to hopefully make with the payers and on the legislative front.
Thank you, Paul. And thanks, everyone. This is a great summary of some of the key themes within behavioral health. This will conclude the most recent episode of Provident Dealcast. Thank you for joining today. Special thanks to Paul and for Tim at Polsinelli, and thank you to the listeners of this podcast as well. Feel free to visit our website at www.providenthp.com for more information around these topics and some others. And take care, everyone. Thanks.